Hey there, beautiful people. Hey, we all know the many benefits that breastfeeding has for us and for our babies. And yet, if we all know how important and how healthy and how essential breastfeeding is, then why is it that at birth 80% of moms start to breastfeed and by 3 months half of them have stopped breastfeeding? Well, I'll tell you why. Because breastfeeding is hard and breastfeeding challenges are real and they keep us up at night and they hurt. And there's challenges like you're a poor latch and sore nipples and a low supply, or challenges like infants that are not gaining weight, or challenges like the baby has a tongue tie, or even something different where you have too much milk and you have an oversupply and an overactive letdown, or you have clogged ducts and mastitis. All of them are real issues that show up, and unless you, the breastfeeding mom, are not well supported by a reliable support team that understands what breastfeeding is all about, then if you're not well supported, then it's really hard for you to navigate these challenges, especially when you have naysayers all around you. So today's episode of Apothecary Wisdom is all about clogged milk ducts, how to treat clogged milk ducts so you can prevent mastitis. And I'm going to share with you midwifery tips and tricks and wisdom and support to encourage you to keep nursing. Okay? So right at the beginning, go ahead, push like on the video, subscribe to our channel, especially if you really value watching videos about birth, breastfeeding, postpartum from a midwifery and herbal perspective. Okay? So I should introduce myself to some of you that are just now meeting me. My name is Maria Chaudhry, and I'm a mother, and I'm a midwife, and an herbalist. And I breastfed my baby and my son for 3 years. And as a midwife, I've attended and cared for families, hundreds of families, to help them have safe home births. And as an herbalist, one impressive thing is the last time I counted, Birthsong has helped more than 30,000 women continue to breastfeed. And so it's really dear to my heart. So let's talk about this, okay? So let's get started and start talking about how to treat clogged milk ducts and how to prevent mastitis. So in the very beginning, in the first few days postpartum, in the first weeks postpartum, there's quite a steep learning curve of learning how to breastfeed. And in your first days, right after birth, your breasts don't have milk yet, they have colostrum. And colostrum is thick golden drops. And think of it more as medicine than as food. So you don't have a large quantity of it, but it's very potent. And then a few days later, your milk comes in and you start to feel really engorged and full and heavy. And then when your baby's nursing, now you can really hear them sucking and swallowing and gulping the milk, and the milk is just flowing out. You're even leaking on the other side. That's a very satisfying, fulfilling feeling when you're making so much milk like that. At the same time, in the first few days, you got a lot to navigate. You have to navigate engorgement. You have to navigate mastering a good latch, and you have to kind of persevere sore nipples. And so that time, that window, is the most common time for clogged milk ducts and mastitis. But just know, clogged milk ducts can happen at other times, and I'll get into that more in the video. But I want you to understand the breast. So let's do a little breast anatomy here. So, for those of you that are listening on SoundCloud, I'm holding a cloth pretend breast. And for all the details of what I'm about to explain, when you go to the blog post, you can see these images, okay? So here's your breast, this is your areola, and this is your nipple. And then underneath, you have your mammary tissue. I don't know if you can see this here. And these red pockets, those are glands, milk-producing glands. So this is where your milk is produced. The yellow is fat tissue. And then these lines, they're canals or tubes. They look like veins or vessels. Those canals carry the blood from the gland down to the nipple. That canal is your milk duct. They take the milk from where it's produced and carry it to the nipple. And so you can see that there are these glands all over the surface of your breast, and these milk ducts are displayed out like an array in multiple different directions. So these milk ducts can easily get clogged if all the milk that's being produced is not evacuated from the breast. And so when the milk stays in the duct, that duct starts to swell and get inflamed. And that's called a clogged milk duct, right? I wanted you to see that. So let's clear up one thing. What's the difference between a clogged milk duct and mastitis? I just described to you what a clogged milk duct is. Like, the milk gets stuck in the duct, and then it swells, and then what do you feel? You start to feel, usually it is on close to your armpit and by your lymph nodes, and you'll start to feel the area becomes really red, rock hard, lump, tender, clog, lump. That's what you start to feel with a clogged milk duct. So now, mastitis, you feel all those same things, red, hot, clogged, painful breast, painful lump, except for mastitis, now you start to have a fever. You start to have chills, body aches, fatigue. You start to feel like you have the flu, right? And so one thing I want to say, also mastitis, it's a very important symptom that really differentiates between a clogged duct and a mastitis infection. So a mastitis infection is when the clogged milk duct, when the milk that's trapped in the duct starts to fester and grow bacteria, and then it becomes infected. Okay, so that milk duct becomes infected, and now the milk that passes through might have pus or blood in it. One thing I want to say right now, remember, the duct is infected, not your milk. So the milk might have blood and pus in it, but technically the milk is still okay and has not gone bad. So keep nursing. The other thing I want to say right off the bat is, if you have the symptoms of mastitis, the fever, the chills, the pain, the fatigue, the pussy, the bloody milk, you must seek medical care. Like, this video is not a replacement for midwifery care. Even though I'm about to tell you and give you all the tips and all the things that I would have given to my clients, it's very important that it has to be treated right away. And also, it's kind of a big deal. It's pretty miserable. And so don't do it alone. Your midwife and your doctor, whoever's taking care of you, they need to know how sick you are, and they need to be able to help you, and they need to help make sure you recover. And so just don't do it by yourself, and get the help you need. Okay? We're good on that? So let's go through what are the 3 most common causes of a clogged milk duct. One more thing I want to say before I go into here. Mastitis always follows a clogged milk duct. So it starts with a clogged milk duct, and then maybe you're able to treat it. Maybe you're able to get the milk out, and that's great. but if you're not, then the next step from a clogged milk duct, then it becomes mastitis. And so I wanted you to know. So all the things that I'm about to talk about, like what causes a clogged milk duct and all the things that treat a clogged milk duct, they're also going to, by extension, going to cover mastitis. Okay, hopefully that makes sense. All right, so the most common causes of a clogged milk duct is engorgement. So engorgement happens when your supply is being established. In the very beginning, like when your breast milk transitions from colostrum to breast milk, your body is wise and it overproduces and it makes a ton of milk, right? More milk than your baby needs. That's engorgement. Your breasts feel hot and full. And so that's one time. Another time that engorgement happens is when a baby misses one of its feeding or one of its nursing sessions. So a newborn baby in particular needs to nurse every 2 to 3 hours during a 24-hour period. And within that 24-hour period, they can have one nap that's about 4 to 6 hours. Ideally, it's in the night, but they can have one nap, right? And then once they get up to their birth weight, they can start to have a slightly different schedule, but that's really 2 to 3 hours. So when your baby misses a nursing schedule, a nursing session, it's a little bit like when your baby sleeps 4, 6, 8 hours that first time, or sleeps through the night the first time, there's a part of you that's like, yeah, I feel awesome. And then there's another part of you like, boom, I feel terrible. Now I have a clogged duct. Was it worth it? I don't know. You tell me. The other thing I want to talk about clogged milk ducts, and I didn't write this down here, but I think it's really pretty important, is clogged milk ducts also happen to like kind of savvy, already a little experienced moms, right? They got their game on. They're nursing they're now capable of nursing their baby and taking care of their other kids, or taking care of their life, or they're kind of ready to go back to work, or they got projects, they're working from home. They kind of have their game on. They can nurse, right? But then there becomes a stressful time. All of a sudden they're under a lot of stress. Or the most common time that I used to get the phone call that I would hear my clients say, I think I have a breast infection, is during the holidays. So like from Thanksgiving to New Year's, because all of a sudden that mom had her normal life, and now all of a sudden she's got to go to the grocery store a bunch, she's got to cook a bunch, she's traveling, she has to go buy gifts. Other people are seeing the baby, so the baby's being held by other people, and so there's more time away from the baby, and they're eating sugar, and they're drinking alcohol, and they're just kind of having a different situation, and they're not like just in their own little house nursing on demand at every second like they were. And all of a sudden, that combination is a perfect storm to bring on a breast infection. And then the other classical thing that I think only a midwife would really be able to call it to your attention is like from midwives and doulas and birth workers. So here they are. Here's a midwife, doula, or birth worker. They're like, boom, they're so excited. They're like, I'm going to a birth. They are, and I'm fully committed to this birth. Like I am present at this birth. And they are at the birth and they're attending this woman, and they start to feel their breast fill up, and they're like, no, I'm gonna be with this woman. And then the next day they're like, boom, rock hard, swollen, infected. They're like, dang, because mastitis can hit you quick, right? And so then the savvy midwife or doula or apprentice, they're like, okay, next time. So at their next birth, they're a little bit more prepared, and so they're fully present with the mom. And then as the mom takes her nap, or when there's a little pause or lull, she'll like, hey, high five. And then she'll rush out to the car and pump her milk really quick, or rush into the bathroom and pump her milk really quick, and then come back and be fully present for the birth. And that's awesome, because birth workers are rock stars. They are able to take care of their own needs. They're able to take care of their baby's needs and their clients, right? And so, but the only reason they learn how to do that is because they got a breast infection first, right? Okay, so engorgement, number one reason. And then the number two reason is poor latch. Okay, poor latch can happen for a couple of different reasons. One is when your breasts are engorged in and of itself is a challenge. Let me kind of show you. I have a demonstration here. Let's see if I can pull this off. Okay, so this is your breast when you have colostrum. So see, it's small and it's kind of soft. See how I can squish it? And the baby can see the nipple sticking out. The baby can latch onto it and nurse. They're not getting that much out, but they can form their lips in the appropriate way, right? But now you're engorged. I don't know if you can see, but see, now you're full and you're big and you're red and you're hot, right? Boom. And see, your nipple, you have your same nipple, but it doesn't stick out like it did because everything's swollen and full, and the baby's having a really hard time getting attached to the breast. And since it's having a hard time getting attached to the breast, then it's not able to effectively pull all the milk out from all those ducts and all those glands, right? So engorgement in of itself is part of the problem, and then it leads to the next problem, which is poor latch. And then I want to show you, so that's one reason for poor latch. Poor latch can be because they can't grab the nipple, but poor latch can also be because your baby is not in the right position. So I don't know if you can see this here. So a good position would be that I have my breast here, and then I can see the ear, and I can see the shoulder, and that's in alignment. And the belly button is facing my belly button. That's a good position. That's kind of straight. Versus, it seems subtle, but it's actually kind of a big deal. Having the baby, the belly button's up toward the ceiling, the shoulder is going that way, and the ear is going this way, right? And so now what's happening is the baby's nursing might look like it has a good latch, but it's kind of hurting its own body. It's like me, instead of taking a drink of water right here, it's me trying to take a drink of water right here, right? And so what happens is it pulls a lot on one side, but not on another side. So they have an ineffective suck, and they can't empty the breast, and it hurts your nipples really, really bad, right? So you want to remedy that, belly to belly, ear and shoulder in alignment. So that's one reason that you're having a clogged duct, is because your baby is in a poor position. The other reason you're having a clogged duct is because your baby is always nursing in the same position. So we learn how to breastfeed a little at a time, in stages, right? We learn one position and we're like, boom, it works. Stick with that, right? And then eventually you learn the next position, and then the next position, the next position. But the problem with always nursing, and this was my favorite, so this is the first one I went to, right? They're always nursing in the same position, then the baby is only pulling from those same milk ducts all the time, and the other milk ducts aren't getting stimulated or aren't getting emptied. So if you want to empty all the milk ducts, you saw how they went in an array, then you're going to have to change your baby's position. And you need to have your baby's chin going toward the swollen duct. So most of the swollen ducts, like I said, are on the side most of the time. So that means you have to switch positions. You can do football hold, or you can lay down. I wish you could see, I could be sidelying and laying down, or you could, but really, you also need to get really creative. And I'm about to go into that. I'm kind of jumping ahead of myself, so I'm kind of jumping ahead. Because what causes it is the babies are all in the same position all the time, so one of the ways to remedy it is to change the position. And so since I'm already talking about it, I'm going to go with it. So changing the position, you can do your classic things like the football hold, but you also have to get more creative than that. So I really recommend that you lay down And when you lay down, you can have the baby just go directly down your body, or then have it at the angle. Then you're laying down, you have the baby up here over your shoulder, and then really you have the baby, kick you in the face. Babies do that. They totally kick you in the face. And they're doing all kind of crazy things. And then you're laying down so it doesn't look so weird, but you have your baby way up here, your feet up here, and then you're nursing your baby like that to change the angle of, because your baby is a powerful sucker. And if you have something stuck, you need to get it out and you have to change the angle. The other way, since I've jumped way ahead, is that it's called Dangle Nursing. And Dangle Nursing, if you've ever had, you'll know what Dangle Nursing is if you've been in this situation. Have you ever been in the car and you're sitting in the back seat, your partner's driving, your baby's over here sitting next to you, and you're sitting in the back seat and the baby's crying, and you're not going to stop and pull over, and you can't get the baby out of the car seat, so you're like, oh shoot, stressed out mom that's going to solve the problem. So the mom reaches over the little car seat and hangs over the car seat and tries to nurse the baby while the baby's strapped in the car seat. So if you've ever done that, then that's the dangle nurse. And if you've done that, you should give me a thumbs up because I'm proud of you. Okay, so here's the deal. A more comfortable way to do dangle nursing is to lay your baby down on a yoga mat on the floor or on the bed or even on the couch, and then you crawl over the baby on your hands and knees, and then you drop your breast into their mouth, and you're utilizing gravity, and the gravity will help you empty your breast milk, and it'll change the angle, and you can even move the baby in a different direction and they'll change the angle. When I say you have to get creative, I really mean it, to change the angle of the nursing positions. Sweet girl. Okay, one other thing that might be happening that's causing a clogged duct is that your baby has a poor latch because your baby has a lip or a tongue tie. And if that's your case, you need a lot of resources and support, and there is a blog for you that's linked in the description that will start you looking in the right direction. For pumping moms, since they're not having to deal with their baby and changing position, part of their clogged duct might be from their breast pump and their flange not being on the right size. So, for example, this is the areola. Imagine I have my flange here, the plastic cone. And when I have the cone on over the top and the areola gets sucked into the cone, then that flange is too big. When I have my flange on and the pump is on and my nipple is rubbing against the flange, against the plastic, that's creating friction, and then that flange is too small. Either way, everything that I just said can contribute to a clogged milk duct, and everything that I just said contributes to sore, cracked, bleeding nipples. So if you have sore, cracked, bleeding nipples, you'll want to see the blog that I posted in the description. And if you have sore ducts, let's keep going a little further, because the other reason that you could be having a clogged milk duct is because your breasts are constricted, because you're used to wearing a super tight bra with the underwire, right? So don't do that. You want to get a nursing bra, nursing tank top, and that'll really help you out, and you won't be so constricted. And they also have these really great bras for pumps, for pumping moms, where you can just place the pump in there and they're not going to put too much pressure onto your breast. Another way that you can cause constriction, it's kind of more mild, minor, like it's not going to create mastitis, but it is something, is when you're trying to nurse your baby. I call it boob wrangling. You're going to try to get that nipple deep in their mouth, so you make the C. There's a common C shape. And then sometimes you squeeze it really tight, just like you're not intending to, but you're squeezing it really tight and you're trying to get that nipple in there. And all this place that you're squeezing tight creates compression on those ducts, and that can kind of clog the milk duct. The same thing happens when you are trying to nurse and you're pressing that breast pump on there to try to get the milk out, and you're creating too much pressure. So that's not so good. And then another form of restriction or constriction that happens is, I clearly remember this was a client, I didn't have this in my own body, this is a client called, she was just like really bummed because she was a stomach sleeper and wanted to sleep on her stomach because she couldn't for so long because she was pregnant. Was really excited about finally getting to sleep on her stomach. And I remember thinking in the back of my mind, like, most breastfeeding moms don't sleep on their stomach, but whatever, you do you. Like, it wasn't something I had to comment on until she calls me the next day and like, I think I slept wrong, and how I was sleeping on my breast created compression, and I think I might have a breast infection. So a clogged duct. And so she had a clogged duct because of how she was sleeping at night. So that's another thing to be aware of. Okay. So I'm about to go into more of the list of things that you can do to help treat clogged milk ducts and mastitis, but just go ahead in the comments if you've had clogged ducts, what do you think caused them? And it's really important that you share it, because it's not just about commenting on a video. It's really about supporting other breastfeeding women, because all of us have different experiences, and the other people that read your comments, they're going to learn from that, and you're going to support them when they're lost and wondering what to do. And so you're going to be a contributor to other people's success. So put your comments and put your experience in, okay? Okay, so when I'm about to go into this list, I have it here. I kind of like what I'm saying. It's like you can do some of these things, and you can do all of these things. But whatever you do, don't stop breastfeeding. Don't stop nursing, especially when you have a clogged milk duct. That's going to just be the worst thing you could possibly do. And I want to restate something, that if you try to do all these things that I'm about to suggest, and you have full-on mastitis with the fever, and you try to do it for 24 hours and you don't get improvement, you absolutely need to go and get medical care. Call your midwife. Like, don't just do it at home. I want to restate that. Okay. And I want to say one more thing about the milk being pussy and bloody. The milk that's pussy and bloody is not infected. It's totally safe for the baby to drink. However, the taste may change. It might taste salty now, and so the baby might refuse the breast. And babies are such vibrators. Mastitis sometimes comes when it's a new mom that's stressed out and she's trying to figure it out and she doesn't know. Or from like an experienced mom that's like stressed out because she's trying to manage life, right? And then she's got this breast infection, and the one thing you need to do is empty the breast, and you need to get that baby to nurse, and now the baby's like reading your vibe, like, I don't know what to do. And then also like, it tastes different. And so then the baby's not really nursing well, and you need it to nurse well, and so you guys are kind of like in a little thing sometimes. So if that's your case, take a deep breath. And if the baby doesn't nurse effectively, then hand express or use the pump. Okay? So I just want to speak to that. Okay, so my mentor midwife used to say, to treat clogged milk ducts and to prevent mastitis, the answer is heat, rest, empty the breast. And those are like super, like those are words to live by. That's good, some good sound advice. I just want to elaborate a little bit. Okay, the heat should actually be wet heat or moist heat. Moist heat and wet heat helps loosen the clog and move the milk more effectively than dry heat does. Moist heat examples are showers, baths, and compresses. And you can also alternate from hot and then cool, and then hot, and then cool. So the heat will expand the breast tissue, and then the cold or the cool will contract the breast tissue, and then you alternate, you expand, and then you contract, expand and contract, and then that creates movement. And that moves the milk, it improves the circulation of the lymph, and it improves the circulation of your immune system. Okay? So Some examples of heat, like I said, are showers. So when you're in the shower, you want to get that shower nozzle going right onto that breast, right? And right onto that sore spot, and then you can do the breast massage. I'm about to teach you the breast massage, but you can do the breast massage while you're in the shower. The next thing is the bath. Now, if you're brand new postpartum and your doctor just said, don't take a bath, I'm like, take an herb bath. It's totally okay. The nice thing about the bath is that you can lay down in the bath and you can submerge your whole breast and your whole side, right? When you're brand new postpartum, or really anytime, your baby can get in the bath with you, especially if it's a postpartum herb bath, and they can nurse, and you can try new positions because the water is more buoyant, and then you can also just rest and relax because it's really helpful for you to just get some stress relief and some relaxation. So there's the bath. I'm going to tell you a little bit more about the herb bath in just a second. And then hot compresses. Hot, wet compresses can be as simple as just clean water, fresh water, clean washcloth, lay it on there. Or, but I used to tell my clients, like get your crock pot out and put your fresh water and your clean cloth in there and then put some ginger root in. When you put ginger root in your crock pot, the ginger is hot and it's stimulating, and that helps stimulate movement and it's going to help free up that clogged milk duct. Or put in your postpartum herb bath, because this bath has a bag inside it and you put your herbs in the cloth bag, and then you put your cloth bag into the crock pot, and then you have all these compresses, right? And then, so you can have these compresses, or you have the herb bag itself and you lay it on there and you can massage. And then when you're done, you've made your herb bath, and then just pour it in the bathtub and then get in all the way, right? The herbs in the herb bath are specifically for postpartum, but they're antiseptic and they're antimicrobial, so they help prevent infection and they're safe for breastfeeding. And also, there's one herb in there specifically, which is plantain, and plantain is really effective at drawing or pulling. So anything that's like that's deep inside that you need to pull it to the surface, plantain can help you do that. There are two other types of compresses that are worth mentioning here. One is a castor oil pack. So I'm not going to go into the steps of a castor oil pack here, so you'll have to research that. Castor oil is powerful and is great at pulling out tenacious clogs that are stuck in there and you really need to get them moving. So castor oil pack. The thing is, you want to just avoid getting it on the nipple, and you want to thoroughly clean it off before you nurse. And then the other thing is, I remember my mentor doing this too, is raw potato. So raw potato, you can slice it or you can grate it up, and you can place it on the breast, and then you can put a saran wrap over it. Raw potato is very cool, so it's great for inflammation, and it's cooling. You're like so hot and full and hurting, and it's astringent like plantain is, and it'll pull and draw that clog to the surface and help it be expressed. So it'll help empty your breast. So not a cooked potato, a raw potato, and a white potato works best. All right, the next thing you can do to help get this milk out is your breast massage. Now, I've made a video about breast massage and Qigong movements and exercises, but just in general, I'm going to show you real quickly here. So you want to realize this is not like, ooh, this feels good. This does not feel good. You have to use gentle but firm pressure with the intention of getting this clog thing out so I don't get sick and have a flu, right? So it's gentle, firm pressure, but I'm trying to tell you it doesn't feel good. At the same time, your breasts are really tender, right? So we're just assuming my clog is over here. I'm using the pads of my fingers, not my fingertips, but my pads, and I'm making gentle circles. So your hand has to be here to anchor it, right? You have to anchor, and it gives you counter pressure. So you're counter pressuring, and you're going to that clog, and you're circling, and then you're traveling the same direction that your milk travels. So you're going from the outer edge toward the nipple, Take your time and do that all, even if your clog is right here, do that the full radius of your breast, right? The full radius of your breast, the full radius of your breast. And then particularly on that clog, do it like 5, 8, 10 times, right? And then when you're in the shower, so you can do your massages, it's great, in the shower with your compresses, in the bath, or if you're not in the shower, just put some coconut oil on there. Some people really like to put essential oils. They're not so my favorite thing, but if you want to, some lavender oil would be okay. Just avoid the nipple and just only use a little bit, really. Anyways, the massage, you want to go, like I said, from the edge to the nipple. The other thing is you use your knuckle and you kind of like you're kneading bread. And see how I have my other hand? I'm compressing and I'm kneading it and I'm pressing it and I'm going from the edge toward the nipple and then sweep it, edge toward the nipple. See, you're thinking, oh, I'm going to do that. You wouldn't do that. But the moment you have a breast massage, you're going to be like, what? You'll be digging in there, right? I'm telling you. All right. So the video of the full massage and the movements to help your milk flow is in the description. All right, we've already kind of talked about changing positions. So that's the third most effective way to clog up this breast milk is to clog up this milk duct, is to change your baby's position. We talked about that really effectively. We talked about Dangle Nursing. This is one thing for breast pumping moms that's really important to know, is pumping moms, they're not going to change their position so much, right? But what happens sometimes, what I notice is they pump and then they're kind of done. They put their stuff away. But what my suggestion is, explore it for yourself and tell me if this is helpful to you, is once you're done pumping, just take a moment or two each side and hand express. My bet is there'll be a little bit more milk still kind of stuck in there, and when you hand express and you're a little bit more specific of where you're getting your milk from which duct, that might help you, especially if you're kind of prone to clogged ducts. And sometimes pumping moms are more prone to clogged ducts. And so hand express when you're finished pumping. That'll be your version of changing the positions. All right. The next thing is really probably should be on the top, which is called rest and nourish, because you want to take care of yourself like you have the flu. If you don't take care of yourself like you have the flu, you quickly will have the flu. So, first thing to do is drink your gallon of water, drink your nourishing herbal and immune teas with chamomile and echinacea, and then eat your chicken noodle soup or your bone broth soup or your vegetable soup like you're sick, right? Eat your fermented foods, your yogurt, your kimchi, your pickles, your kefir, those types of foods. And really just crawl into bed, get skin to skin, and nurse your baby. That's the best thing you can do. So before I get into the herbs and supplements, I want to hear from you and put in the comments if any of this has been working for you, that you've tried and it's been effective. Okay, when you think about herbal supplements for clogged ducts and mastitis, the first thing that comes to mind is sunflower lecithin. When I was training in midwifery world, we always said soy lecithin, but now everyone's turning to sunflower because soy has some like phytoestrogens in it. But so lecithin thins out your breast milk. So it doesn't create more milk, it thins it out. So if you have constricted or clogged ducts, the milk can pass through the ducts quicker. Also, lecithin is really great for your healthy brain, and so it's good for mom's healthy brain and your baby's healthy brain. And so if you take a capsule every day with your meal, and if you're the mom that's prone to clogged ducts, this might actually help you not get so many clogged ducts or infections. The other piece that's super beneficial are probiotics. I mean, we all know about our gut health, and when we have a healthy gut, that's a a reflection. Like when our gut is healthy, then every other part of our body is healthy, right? And our microbiome and what we eat and how we feed our microbiome is super important. And so there have been some studies about probiotics, and these 2 strands of probiotics, I'm going to read it for you. And on the blog it's written out so you can know what it says. But it's Lactobacillus fermentum and Lactobacillus salvularius. Those 2 strands are shown to be more effective than traditional antibiotic treatment. And those 2 strands lead to a healthier gut and a healthier microbiome, where antibiotic treatment, traditional antibiotic treatment, as we know, is going to destroy and kill a lot of your gut flora, and it often takes 6 months or more to restore that microbiome. And so if you can do something that's going to help your gut health and keep your microbiome intact, that's even more effective than go there first. Okay? Vitamin C. Vitamin C is really great for your immune health, and it's also really great for vascular integrity. And so when you're having these milk ducts, it can help these milk ducts function better. And then you have your antimicrobial herbs. I always save the best for last, all the herbs, the best for last. So your antimicrobial herbs are garlic, echinacea, elderberry, thyme, Oregon grapefruit, right? All of those are powerful infection fighters, and they're safe for breastfeeding moms. So if you already have some of our stuff like on your shelf, you're like, oh, I already had some echinacea and some elderberry complex because I wanted to boost my immune system, because we tend to talk about elderberry complex for coughs and colds and flus, but guess what? This feels like a flu. So elderberry complex is going to be really helpful. And then children's immune boost is really helpful. I know it says for children, but that's the broad thing about herbs, that why I love them so much, is that they can reach and take care of so many different people with so many different ailments. And so these 2 remedies you could have in your herbal medicine cabinet that can take care of your whole family, and also can help you if you have a mastitis infection. Okay? So one last thing I want to say before I wrap this up is you're going to have to get in touch with your body to determine the signals that your body is telling you. So after you've done your treatment, your breast might be sore because you just kneaded it and hot packed it and dangled it and jiggled it and massaged it and all the things, right? And your breasts are not used to that. Plus it's making milk and you're pumping and all, you have extra stimulation. And so you have to determine, is this breast soreness that you're feeling now part of the recovery process, or is this breast soreness a lingering part of the infection? And that's something that you're going to have to get in touch with your own body to find out. Okay? And I think that's really important. Well, beautiful. I hope you got some tips and some insight on why you get clogged ducts, and hopefully this will help prevent you from ever having a mastitis infection or prevent the next one from happening. And just know, breastfeeding is hard. You're a good mom. You're doing all the right things. And challenges are anticipated. You have to expect them. You have to know they're going to be a part of the path, and you have to have the skills to navigate and the support system to navigate through, right? And so we're here and to support you, because I fully believe, 100% believe that you got this and you can keep going, right? And I want you to know I linked all the herbs below. I linked those blog posts that are important for you and the massage video below. And if this was helpful to you at all, share this video with your friends so more women can know about this, because the more women know, the more empowered we are, and what a better world we live in. Go ahead and push like to this video, subscribe to our channel, and until next time, my friends, drink deep and let your love and your milk flow.